In this example, we're going to take a look at how cocaine produces its characteristic high and then crashes once its effects wear off. The neurotransmitter that we are dealing with here is dopamine. Dopamine is released in the reward centers of the brain and increases our feelings of pleasure. And when dopamine binds to its receptors on the postsynaptic neuron, it opens ligand-gated sodium channels, allowing sodium to enter the postsynaptic neuron, thereby causing depolarization of the postsynaptic neuron. And so the postsynaptic neuron is excited. In effect, an EPSP is formed in the postsynaptic neuron. Once dopamine has finished its job, however, it must be returned to its synaptic vesicle. This is done by the dopamine reuptake transporters or dopamine reuptake receptors that are present in the presynaptic neuron. In this way, dopamine is returned to the synaptic vesicle, and so the levels of dopamine are not too high in the synaptic cleft. So this is where cocaine comes in. Cocaine blocks the dopamine reuptake receptor, thereby blocking the return of dopamine to its synaptic vesicles. So the levels of dopamine increase greatly in the synaptic cleft, thereby producing a very high level of pleasure, which is your characteristic high from cocaine. So what happens when cocaine levels go down? When the effect of cocaine wears off, these dopamine reuptake transporters open suddenly, and a great rush of dopamine goes back into the synaptic vesicles. As a result, the levels of dopamine is extremely low in the synaptic cleft, thereby causing the crash, which is characteristic after the effect of cocaine has worn off. Here's an example of how Prozac, a popular drug that is used to treat clinical depression, works. The neurotransmitter that we are dealing with here is serotonin. Serotonin increases feelings of contentment. When serotonin binds to its receptors on the postsynaptic neuron, it opens ligand-gated sodium channels. Sodium rushes in, causing depolarization of the postsynaptic neuron, thereby causing an EPSP. Once serotonin has finished its job, it is returned to its synaptic vesicles via serotonin reuptake receptors. They are very similar to the ones we saw for dopamine. These are present in the presynaptic neuron, so that levels of serotonin may not increase too much in the synaptic cleft. Here comes Prozac. When Prozac is prescribed, it blocks the serotonin reuptake receptors, or not all of them, but some of them. As a result, the levels of serotonin gradually increase and serotonin accumulates in the synaptic cleft. As a result, there is an elevation of mood and feelings of contentment.